PHL 17 presents In Focus, a look at the issues affecting the Philadelphia region.
Well, thank you for joining us for In Focus. I'm Jennifer Lewis Hall. Our focus today on In Focus, the opioid crisis and Mayor Jim Kenney's task force to combat the opioid epidemic in Philadelphia. The national crisis now claims the lives of more than 28,000 Americans each year. The task force is co-chaired by two city commissioners. Arthur C. Evans Jr. is joining me today, and Dr. Thomas Farley. Welcome to both of you.
Thank you.
Thank you.
There have been a number of public meetings held so far, and really this is a very big step, you feel, in dealing with this epidemic. Tell us about, we said 28,000 lives, sadly, a year are being taken by this. And up on the screen here for our viewers as well, you anticipate having had 900 drug overdose deaths in 2016. That is with toxicology reports pending, and this is up from 702 in 2015, the year before. And what is really staggering here as well, 3 times the number of homicides in the city, and overdoses, of course, becoming a leading cause of death in the city. Just a response even to that, and so many families and individuals dealing with this, and families really suffering.
Sure. Well, thank you for having us. This is the worst opioid crisis that this country has ever had. And the numbers that you talked about are just the tip of the iceberg, because the economic impact, the impact on child welfare, the impact on crime, the impact in so many areas of our economy and in so many areas of our lives is staggering. And I think the reason that the mayor wanted to do the task force is that this is a very complicated issue. And Dr. Farley, myself, we run agencies that do a lot of work in this area, but we recognize that we can't do it alone. We need the private sector, we need the best research, we need educators, we need people from across the spectrum, law enforcement. And so the mayor felt that it was important to pull together the best minds, best thinkers in town to look at this issue in a comprehensive way and to come up with a comprehensive strategy.
Also weighing in with that, Dr. Farley, what are your thoughts as we look at the numbers? We know that behind every number there's an individual that means a whole lot to somebody out there and that people love, and this crisis is really weighing heavily on our city, on families and individuals.
Yeah, as Dr. Evans said, this is the tip of a very large iceberg. So give me a sense, 900 overdose deaths a year, but there may be 50,000 people out there who are using heroin, and 50,000 people who are addicted to prescription painkillers, and maybe 150,000 people who are using prescription painkillers maybe more than they ought to. And that's 10% of the entire city. So it's a problem that really touches almost everyone. It's a problem that's taken us a while to get into, and we're going to have an awful lot of things to do to try to turn it around at this point.
Why do you think it's been up until now that this task force, obviously Kenney is under new administration looking at 2016, and now fast forward to 2017, there's always a lot of work to be done in government, quite honestly.
Sure.
But you're saying this is a pivotal time, not only with these numbers, but you're talking about areas of the city. We'll get into that more, but Kensington, other parts of this, no part of the city, suburb, town, any place you look is immune to this situation.
Exactly. Well, I think we reached a tipping point, and I think when we looked around that there were a number of initiatives that were popping up all over town. So you had some people that were coming together around what data should we collect, and other people were coming around together around Narcan and overdose prevention. So what became clear to us is that if we're going to really get a handle on this, we really need to have a common framework, a common approach. We should know what each other is doing, and we should be all rowing in the same direction. And so it wasn't that people weren't responding, we were just doing that in a very uncoordinated way.
And you're saying now you're getting that together. We do have some information on the task force website. Folks can go there, to the city site. If you want to give some information now, that's great. We'll be talking about that throughout the show. But hashtag PHL opioids is also where you can get involved in the conversation on this. And then right, of course, on the city site as well, you can link into the mayor's task force. Tell us more about the charge of this. As city officials were saying, I got this right from the site, that the last 4 years of overdose deaths by quarter, again showing an unrelenting rise in overdose deaths, and something that's really so important to point out, that 80% of overdose deaths involve opioids.
That's correct, and you know the charge really is multifaceted. One, obviously, is to save lives. That's one of the main purposes of doing this. But it's also to try to get further, what we call further upstream, to prevent as much opioid addiction as possible. And I'm sure Dr. Farley is going to talk more about some of the guidelines that we've issued as a city around that part. But it's to try to prevent, it's to save lives, it's to also make sure that we have the best available treatment and that people can get access to treatment when they need it. One of the unfortunate things that happens with addiction is that often people, even if they are motivated, often don't know how to access services. Often there's stigma associated with accessing services. And so for many people, they will suffer for long periods of time before they get the help that they need. And so one of the things we want to do is to make sure that the public and the community has the information that it needs to get the help that they need.
Very important stuff you're talking about here. And just, you know, who is on this task force? There are a number of subcommittees that will deal with data analysis, public education and prevention, the justice system I read, and overdose prevention, which is something I want to bring squarely to you, Dr. Farley, and really dealing with because that's the core. To me, that's, you know, collecting the data is key in looking at, I'm sure, the results.
Sure.
And then your solutions that you'll be coming up with, potential solutions. But as you look at overdose prevention, and it says harm reduction, dealing with those issues, clinical process, behavioral health involved in that, a lot of layers dealing with that as well.
Yeah, there are many different things we need to put into place to address this enormous problem. Just take overdoses for a minute. Fortunately, we have a drug that's available that's completely safe, that's an antidote to opioid overdose. And if people find someone who looks like they've overdosed that may be dying, anybody can give them that medication and prevent that death.
Narcan.
Yes, Narcan, otherwise known as naloxone. And so making that available in more places to more people so that somebody's likely to have it around when an overdose takes place is an important piece to all of this. And we've been working on this, but we need to do more on that. That won't solve all the problem with addiction, and it won't solve the people who might be getting addicted in the future. But that's one piece that we need to make sure we get right here.
Areas of the city that you all will also be focusing on will be numerous, but highlighted in some of the material. It talked about deaths that have been concentrated in North Philadelphia and also in Kensington neighborhoods. But again, no area is spared, but a very high concentration of deaths with long-term issues there involving heroin and this type of crisis. Explain more about that.
Well, you know, what happens, one of the things we do in the city is that we map a lot of statistics, and so we map where there are concentrations of overdoses, Narcan rescues, and so forth. So we know the areas of the city that have the greatest impact, but as you said, if you look at a map, it's the entire city. One of the things that we've learned is that if we're going to make an impact and move the needle on some of these issues, we have to have place-based strategies. There are certain areas of the city, and those areas where you have high concentrations of drug trafficking. One of the challenges in Philadelphia is that you have some of the highest purity heroin in the country here. In addition to that, it's some of the cheapest, and so that combination of cheap, high purity heroin makes it very difficult to deal with this issue. And so we will be targeting, and in fact are already targeting, some of those areas of the city where we know that there are these high concentrations of overdose deaths and high areas of trafficking.
Yeah, we're going to be talking about this throughout the show. Folks, stay with us for this. Ahead on In Focus on PHL 17 in Philadelphia, how much have sales of prescription opioids increased? That's straight ahead. Stay with us. Joining us once again to talk about the Mayor's Opioid Task Force in Philadelphia are its co-chairs, Arthur C. Evans Jr. Joining us once again, and Dr. Thomas Farley, as the task force is seen and seeks to be very effective. Gentlemen, thank you for being here. In order to make something effective, you have to drill down on a lot of things. What is the real issue? What wasn't targeted in the past? What didn't work in the past? And then how many folks can you get to bring on board? And that seems like that's been a major component of this as well. Tell us a little bit about who's joining you for this and why you think that those agencies and individuals will be so key in making a difference.
Sure. So we have individuals from law enforcement, from the DEA, from a local law enforcement, the police commissioner, prison commissioner, because there's clearly a criminal justice aspect to this. One of the things that we want to do is to make sure that we are diverting people out of the criminal justice system that really don't need to be there, who need treatment, and so we need those individuals. We have people from the treatment world who are working with individuals who have opioid addictions. We have researchers because we believe that it's really important to use the best science and the best research that's out there as we're making our decisions. We have policymakers like Tom and I who are also doing this kind of work. So it's really a range of people because we know that this is a complex issue. It's going to take multiple perspectives, and there is no one pathway. There is no one set of strategies that we can employ, but we're going to have to attack this issue from many different perspectives.
Dr. Farley, your thoughts? I'm looking over the list. I have it in front of me, about 20 individuals, including yourselves. That in addition to the list that also you just named, Mr. Evans, you're talking about the fire commissioner is also on this. As you said, clinical professors from different areas as well. And really looking at involving, as you said, a number of folks in the area of treatment and prevention and getting medicine clinicians involved with law enforcement, would you say is the way to go?
Yeah, we need to have all kinds of perspectives on this, and a lot of the reason we have the problem, frankly, I should say this as a doctor, is because the medical system has provided too many of these prescription painkillers for a long period of time now, and people have become addicted through that. So involving the medical society and medical providers and health plans is important on the task force because we really need to change physicians' practices.
And that's something we're going to talk about too throughout the show in terms of what needs to happen. We've had folks from DEA on with us, clinicians on with us talking about this issue and really getting a handle on it. At the base, you're saying too many of these pills are going out, and oftentimes they end up in the hands of folks that went in for a sprain, a break, and this is where they are now. In Philadelphia, sales have increased 4 times since 2000, opioid sales quadrupling between 2000 and 2015, and it says there that despite this increased attention to the matter, that sales have not decreased. Each of you, what does that say?
I mean, I find that shocking and really very upsetting. I mean, this is something to me feels like we've had a lot of publicity about in recent years, but still there's an awful lot of prescriptions being written for opioids. A lot of that is unnecessary, and these drugs are inherently dangerous. Back in the 1990s, what happened is some drug companies decided that they could make more money by selling prescription opioids for the treatment of chronic pain, like arthritis and backache, which in the past it wasn't used for that. And physicians who want to relieve pain started prescribing more. And so you saw a rise in the number of prescriptions for opioids, and a rise in the number of people who became addicted, and a rise in the number of overdoses. And over time, as those people have learned that actually once they're addicted, it's cheaper to use heroin. And so now we're seeing a heroin epidemic in the wake of that.
And for people who are just joining us or haven't seen a previous program that we've done or haven't tapped into what this means on the clinical side of things, these are things that are in your medicine cabinet. If perhaps you've had, like I have, a tooth pulled, or you've been to the dentist, or as you said, you've had back pain. It's not something where you say, well, that's something so out there, I'm not familiar with it. Tell us the types of drugs we're commonly talking about, that you're talking about in the community, and why inherently they are so powerfully addictive. Give us the clinical point.
Trade names that people may recognize would be OxyContin and Vicodin and Percocet. These are drugs that they may have a role in acute pain if you have a bad fracture and you're in a lot of pain for a day or so, but there's no reason to get a 30-day supply of those pills, and too often doctors are giving people a 30-day supply of those pills, and after they use them for a day or two, they put the rest in the medicine cabinet, and then they're there for people to abuse or teenagers to use and bring to a party, and so there's just an awful lot of these pills around. And these drugs, after you're on them for a couple of weeks, you're already starting to get dependent on them.
And you're saying very easy to do. People say, you know, especially children going in for a sports injury. We've seen so many different types of stories where young people have become addicted, going in and trusting their doctors and saying, you know, listen, this will relieve the pain, and then a child has become addicted as well. Something that I read talking about getting ahead of this, bending the curve downward, essentially is how it was written in the materials that I received from you all, talking about addressing the problem. Also, then from this angle, from a medical perspective, will be key. Are doctors listening? Are they changing? You know, you're in the medical field. Are they going to make radical changes?
Well, I would say that they're not making big changes yet. That's what the data show us. And so one of the things the task force needs to do is to figure out, working with the medical profession, how to get them to make big changes in this. Because if the levels of prescribing we're having now, we're going to continue to have people get addicted. I think that's possible, but it's going to take some work, and it's going to take some time.
And also, you talked about the purity of drugs. So there's inherent problems that existed along the way. You know, that are very troubling. But also then talking about, you know, there's a photo of, you know, drugs in a bottle, you know, $25 of the opioid, and heroin, you know, at $14.
Sure. You know, one of the things I think is real important is to remember that there are multiple pathways to drug addiction. And even before we have the current crisis, there were many, many people, thousands of people who were becoming addicted in our community. And there are people who are becoming addicted who are not becoming addicted because they were first given a legitimate prescription. And so I think as we look at this issue, we absolutely have to make sure that from a medical practice standpoint that we're addressing those issues, but we also have to think about the other pathways that have led people into addiction. And for example, one of the things we know, for example, is that for people who've been traumatized, that often people will self-medicate and they will develop an addiction to cope. That is still happening. And so even as we're looking at this issue in terms of the prescription drug issue, we have to also think about those other individuals in our community that are coming into their addiction in other ways as well.
And would that be a pathway to also say then there needs to be more effective ways to get people to recognize that they have the problem? Some people think about depression, and you talked about trauma.
Sure,
that can come in many forms.
Absolutely.
So it could have been a traumatic experience from childhood, or you're saying it could be from a victim of a crime,
right,
or what have you. And you're saying the coping mechanism, even to recognize in some communities, which we've talked about here on In Focus, that there are mental health issues in our community, that there are issues dealing with depression.
Exactly.
You'd have to recognize a lot of times, and that can be tough for folks to say, I have this problem.
That's exactly it. And I think that, you know, I'm a psychologist. I've worked in the mental health field as well for many years. And one of the things that we've recognized is that many of the people who come into both mental health treatment and addiction treatment have these early childhood traumas that lead them to maladaptive behavior, often drug addiction. And so it's a complicated set of issues that we have to look at as we're addressing this issue. I think that you know, when you talk about bending the cost curve, about bending the curve around this issue, one of the main things that we have to do is to intervene early. And I think to intervene early, we have to deal with the issue of social stigma around addiction. Many, many people in our community don't access treatment, not because they don't know how, but because they are embarrassed, they're ashamed. Right. Their family members often don't want to acknowledge that a person has an addiction.
Will the task force be integral in helping to change that stigma, helping to change that and get out into the community?
I think it's an issue that we have to take on, because what typically happens is that service systems, healthcare systems, we're so focused on treatment and people having access to treatment that we almost completely ignore the issue of stigma and how that impacts on people getting into treatment. Right. I've always believed that we could build the best treatment programs in the world, but if people are embarrassed to go or ashamed to go, it doesn't matter. And so I think, you know, one of the recommendations that I'm certainly going to push for is that we take on some of these bigger issues that are impacting on people's ability to get help.
All right, we're going to drill down on that more too straight ahead. Up next, solutions and the opioid crisis and what may be key in accomplishing the task force's goals. Stay with us. In Focus continues now. I'm Jennifer Lewis Hall. We are discussing the very important issue today of opioid addiction and a task force formed by the mayor of Philadelphia. The co-chairs of that task force are with me once again. Arthur C. Evans Jr. is joining me and Dr. Thomas Farley. Solutions key to this issue. You've had a number of listening sessions across the city with individuals and people talking about what they've been going through. I just want to get your reaction to what are some of the things that were those that you still remember out of those sessions, each of you?
Sure. So I think one of the things that people are saying is that there needs to be free and open access to treatment when people need it. One of the things that happens when you have an addiction, you may be ready today, but not so ready tomorrow or even the same day. And so it's really important for people to have access to treatment at the time that they present for treatment. I think the other thing is that people want to for those people who have lived experience, we talk about people who have gone through the process of recovery and are doing well, that those folks really want to be a part of the solutions. And one of the things we know is that when people are working with people who've gone through a similar experience, they tend to engage a lot more. And so there's been a lot of people who are coming from the recovery community who have said, we need to be a part of the solution in systematic ways. In fact, that's one of the things that has happened here in Philadelphia to a very large degree. I was going to say, you'll have semi-monthly meetings that you're holding through March, but then also public meetings have written minutes, so people can comment, which is very important. But also part of this will be presenting this final report. And please do weigh in here, Dr. Farley, at the end of April. One of the key things that was presented in terms of gearing up for that, reducing overprescribing of opioids, increasing treatment, and 3, increasing availability to use of Narcan or naloxone. Talk about each of you solutions. What, if you could give us a window into where you're headed with this, what will be some of the things you believe you'll be presenting? Well, I do think that we're going to talk about treatment and treatment access. One of the things we know is that medication-assisted treatment is a very effective strategy. There tends to be a lot of stigma associated with that, methadone, for example, but that has the best evidence in terms of effectiveness for opioid addiction. We have to take on the issue of NIMBY, not in my backyard, because we have, even when we've had the funding for programs, it has taken us a very long time to cite programs. In fact, the last methadone program that we just opened last year took literally 7 years. We had the funding 7 years ago. It took us 7 years in order to cite the program because no one wanted the program in their community. But many of the communities that are most impacted by this issue are the same communities that say we don't want those programs in our community. So we have to deal with that issue if we're going to get a handle on this.
And you're saying, and then really be proactive with communities around there, because you're saying it's impacting various communities. It's not just one. Dr. Farley, please weigh in here. What is going to be key, you feel? What are some of the things that you hope will end up in that end report as you all produce that report at the end of April to the mayor?
So, you mentioned the 3 broad areas about trying to reduce overprescribing and increase access to treatment and reducing overdose deaths. Those are sort of broad areas, and what we need the task force to do is to figure out how we do that. How do we change physician practices? What's the role for maybe detailing visits to doctors' offices to educate them? What's the role for health plans in changing physician practices? On the overdose prevention side, we have our EMS services have naloxone and uses it all the time. Our police officers do in the hardest hits areas of the city. But how else can we get it out there? Because often they're not there when that overdose occurs. So there's an awful lot of details about those broad concepts that we really need some very practical solutions to. There are 5 different subcommittees of this task force that are subject matter experts that are going to be really getting into depth on that, and they're going to be coming up with recommendations based on their discussions and public input, bringing them to the task force, and they'll hash it out there, and in the end that's going to be in that final report, and then it's up to all of us to figure out how to implement that idea.
Where can people go who need help today, right now? We also had the hashtag up there to engage in the discussion, hashtag PHL opioids. That's to keep that discussion going, obviously. We're seeing that on the screen. Also the task force, where can folks go?
Sure, people can go to our website. It's called healthymindsphilly.org, one word, healthymindsphilly.org. At that website, you can get information about all of the treatment resources that are in Philadelphia, every licensed treatment program. You can search by your zip code. You can put in keywords like Spanish speaking, And so that website will allow you to get the information you need for access. Would also encourage people to go to the website for the task force, which is phila.org, phila.gov, /opioids, and you can get information about the task force itself.
Is there a target in terms of when you look at this broadly and you say, does a task force go about perhaps looking at certain areas first, demographics of the city by area and zip codes, some of this information that's compiled presumably is broken out that way so you can see what you're dealing with?
Sure.
Will they look at maybe hardest hit areas first? What might be the strategy that you hope to accomplish as you look at your numbers and your information and you've heard from the public?
Well, I think one of the most important things is to have an overall approach. What will get us the biggest bang for our efforts? Clearly, working on physician prescribing practices is one of those strategies, but there are a lot of other strategies. And so the main thing is, what are the things that we want to put at the top of that list? I do think that place-based strategies is going to be a major part of this, because we do see these issues clustering in certain geographic areas. There's certain cluster in certain demographic groups, and so we want to make sure that we are doing specific outreach to those groups and into those areas of the city.
And Dr. Farley, do you feel, as many others do, that this is not something that you can wage, particularly with citations or incarceration, that this is an addiction issue, and maintaining that it's going to require mental health clinicians and others to really get to heal people?
Absolutely,
people.
yeah. Too often drug use is seen as a problem just for law enforcement, and this is really thinking about people suffering from a disease or a medical problem. And it doesn't mean that some people don't often commit crimes in the process of dealing with their drug addiction, but drug treatment is where they need to be, and so discussion about how we divert people from jail into drug treatment is really important here.
All right. Well, thank you so much, gentlemen. We'll see you back, we hope, in April as you release your report and when the mayor has that in hand. Thank you very much and good luck and for your efforts, and thanks for being here today. Again, Dr. Thomas Farley and Arthur C. Evans Jr. with us today, co-chairs of the Mayor's Task Force. That'll do it for us here. I'm Jennifer Lewis Hall. Please join me again on Monday morning, starting at 5 a.m. for PHL 17 Morning News. On behalf of all of us here, have a great weekend.